Hello. Today, Salma, Clara, Athena, Emma Rose, Ella, and I will be presenting to you our final project entitled ADHD and its impacts on academic success and relationships. Now, for a bit of information on the disorder in the mental health context, attention deficit hyperactivity disorder, which is more commonly known under the name of ADHD, is categorized as a mental health disorder that results in impulsive behavior as well as an above average level of hyperactivity. In everyday life, this disorder then consequently impacts one's academic success as well as the relationships they create. ADHD is known to be one of the most common neurodevelopmental disorders diagnosed in children and is usually lasting until adulthood. As previously mentioned, the disorder does have an impact on academic success and the relationships that the individual makes because of aspects like problems with attention, working memory, distraction, procrastination, impulsiveness, and being easily frustrated. The main areas of the brain that are affected by ADHD include the frontal lobe, temporal lobe, the limbic system, the basal ganglia, and the cerebellum. Studies have found weaker structure and function from the prefrontal cortex, especially in the right hemisphere of those who have ADHD. The prefrontal cortex, also known as the frontal lobe, plays a crucial role in regulating behavior, attention, and emotion. Another part of the brain that is affected is the basal ganglia. A deficiency in this part can lead to cause interbrain communication as well as information to, in quote, short circuit, which results in impulsivity or inattention in the individual.
Within the next slide, we will give a short definition of ADHD, present the symptoms in early childhood, adolescence, and adulthood. We will address the three presentations of ADHD. We will give an overview of ADHD in the lifespan, and finally, the causes of this condition. Within the next, what is ADHD? The majority of people find themselves having trouble with paying attention and controlling impulsive behaviors. However, people with an ADHD disorder face with persistent issues in controlling impulsiveness and paying attention. Nonetheless, deficient or hyperactivity disorder is a neurodevelopmental disorder, and it affects 11% of school-aged children. The disorder's current name reflects the importance of its different characteristics. It is usually characterized by developing inappropriate levels of attention deficiency, impulsivity, and hyperactivity. Without proper care, people who suffer from ADHD deal with serious consequences. These can include minimal brain dysfunction, hyperkinetic reaction of childhood, and an attention deficient disorder with or without hyperactivity. Finally, they have issues with effective function, which is the brain's ability to prioritize and manage thoughts and actions. This function permits individuals to consider long-term consequences and help guide their behavior more effectively. These issues are seen in individuals suffering with ADHD, which means they have difficulty completing everyday tasks and forgetting important things. What Symptoms for ADHD usually start to appear in early childhood, and several of them are required to be present before the age of 12 to be properly diagnosed. Parents usually start by reporting an excessive amount of motor activity during toddler stages, although this can be typical active behavior in kids aged under 4, so it is hard to distinguish from ADHD symptoms. In order to make that a diagnosis, children need to show 6 or more symptoms of the present disorder. As for adolescents 17 and older, and adults, 5 symptoms are usually required for diagnostic. There are 3 categories of ADHD, including being predominantly inattentive, hyperactive impulsive, and combined. Here are the three presentations of ADHD. A predominantly inattentive presentation in a person is defined by the failure to give close attention to details. They have difficulty staying attentive and usually appear not to be listening. They're struggling with the following instructions, organization, and usually avoid tasks that require mental effort. They're more forgetful and prone to losing things as they're easily distracted. As for a person with ADHD predominantly hyperactive impulsive presentation, they have more difficulty remaining seated and are often seen fidgeting or squirming. They usually show excessive active behavior in children and extreme restlessness in adults. They struggle engaging quietly and will talk excessively, often blurting out answers and cutting people off. They show difficulty in waiting and taking turns. Lastly, some people have combined presentations, which means that symptoms from both presentations are present. It is also possible for symptoms to change over time, whether that means adapting new symptoms or losing some. Within these presentations, there are three categories of severity: mild, moderate, and severe. The first category is mild, which is where there are only a few symptoms past the required amount for the diagnosis present. They result in minor impairment on social, school, and work settings. As for moderate ADHD, it is when the symptoms or the functional impairment present sits between mild and severe. It is said that 50 to 80% of the time, ADHD persists from childhood all the way into adolescence. Lastly, the severe category is where there are many symptoms past the number required for diagnosis present. And several of them are severe and cause a greater impairment in social, school, and work settings.
Now I'm going to talk about ADHD in the lifespan. So, children with ADHD often experience delays in their independent functioning and can even end up showing younger behavior than they actually should. Many of these children may have experienced mild delays in language, motor skills, or even in their social development. In fact, children with ADHD tend to have a low frustration tolerance and a lot of mood swings due to their difficulty to control their emotions. People with this disorder also have serious problems in adolescence and adulthood, such as academic failure or delays when it comes to their education, issues with driving, difficulties with peers, or even in certain social situations. They can also face issues when it comes to the substance abuse, and they can sometimes have risky or unusual sexual behavior. Furthermore, some severe negative behaviors can present themselves when ADHD is found with coexisting conditions like conduct disorders or the oppositional defiant disorder. In addition, teenagers with ADHD tend to struggle much more than regular teenagers going through their regular teenage years. Finally, more than 75% of children diagnosed with ADHD continue to experience symptoms of ADHD up to their adulthood. In that case, ADHD disorders in adulthood can be sometimes harmful because they are associated with depression, mood disorders, as well as conduct disorders, and even substance abuse. When it comes to ADHD, there has been many studies conducted all around the world amongst children, adults, and older people. Therefore, researchers are not able to pinpoint the exact source and the exact causes of ADHD. They actually discovered that there is a genetic link that exists. Since ADHD sometimes runs in families, a numerous number of studies show evidence that ADHD is probably inherited. ADHD is also a very complex disorder with the result of many interacting genes. In fact, some scholars have found many environmental factors that have chances of increasing the likelihood of having ADHD. For example, the exposure to pesticides and early childhood, the premature birth or low birth weight, and brain injury. Furthermore, researchers
are still trying to study these relationships between the disorder of ADHD and its environmental factors. In that case, they affirm that there is no single cause that explains all the cases of ADHD. There are always have been many factors involved in many situations. In addition, the symptoms of the disorder cannot be caused by family stress. Of course, issues in parenting styles can actually affect the severity of ADHD, but they do not cause the disorder itself. Therefore, ADHD is definitely a brain-based disorder. Finally, more research is still in progress to better help define the areas and the pathways of the brain that are actually involved with this unique yet well-known disorder.
Now, for a bit of historical background behind the disorder. The disorder was first mentioned in the year of 1902 by a British pediatrician by the name of Sir George Frederick Still. He noticed what he had described as, and I quote, an abnormal defect of moral control in children. Some children were unable to control their behavior and actions the way a typical kid would, but this didn't take away from their intelligence. Originally, ADHD was called hyperkinetic impulse disorder, and it was only until later that the American Psychiatric Association finally formally recognized ADHD as a mental disorder in the year of 1968. ADHD was the first disorder to be found to be the result of a deficiency of a specific neurotransmitter. In this case, it was a deficiency in the neurotransmitter named norepinephrine. Norepinephrine is very closely linked to dopamine, which is the thing that helps us regulate the pleasure and reward center. With time, many medications have come about as a means of helping lessen the symptoms of the disorder as it got better understood and diagnosis began increasing in the 90s.
The fundamental attribution error theory is when people make the tendency to explain or assume other people's behavior as the result of personal rather than situational factors. Because of the fundamental attribution error, we are quick to assume that the cause for someone doing a bad thing is because they are a bad person. We are predisposed to ignore any situational factors. In order to make attributions, there are two steps that are needed. One being to focus on the person in order to make an internal attribution, and the second being taking the situation into account, like allowing for any situational factors. In this theory, step 2 is often skipped. This theory is seen a lot with people that have ADHD. Many that have ADHD have a difficult time concentrating, often experience constant fidgeting, unable to sit still, being impulsive, and many more. This makes it hard for people to form relationships because the people around them assume that they are weird or too hyper instead of considering the external attribution, which is being that they have ADHD. This also impacts academic success a lot because those who struggle with ADHD often need extra help, and if that help isn't being provided, it can make school extremely difficult for them since they are easily distracted and have a short attention span.
An interesting article written by Rana Parek, a physician from the American Psychiatric Association, discusses the possible treatments to help with the symptoms of ADHD. Medication is the most used treatment when diagnosed with ADHD. There are two types of medication available, stimulants and non-stimulants. It is important to note that this medication is safe to give to children, but it needs to be carefully monitored by their parents. Nonetheless, stimulants are known to be highly effective due to the rapid result which causes the individual to feel dramatic relief. As for non-stimulants, they are short-acting and temporarily reduce side effects. When an individual has ADHD, their brain is always on high alert. Therefore, having a medicine that can balance these symptoms is rewarding. That being said, the person will eventually gain more control in organization as they get older, but from the ages of 12, the symptoms are highly disruptive for the child's daily independent functioning. The second treatment that has proven to be effective is therapy, more precisely, behavioral therapy. The targeted patient for this type of therapy are children because it is easier to teach the child from a young age and help them to control their behavior and their impulsive decisions. In addition, the therapist will provide support and guide to the parents by providing positive reinforcement for desired habits and punishment for undesirable ones.
To conclude, ADHD can drastically impact many aspects of someone's life. For instance, children with ADHD usually struggle with impulsivity and with their social skills. Most of these children also tend to become more aggressive when it is time to control their emotions, and if their emotions are not controlled properly, which can actually negatively affect them on the long term. Moreover, this unique disorder also affects the attention span and the level of energy that people that are diagnosed with it have. In that case, if people who have ADHD are not treated with care, they can actually suffer from serious consequences such as minimal brain dysfunction, hyperkinetic reactions of childhood, and even attention deficit disorders with or without hyperactivity. Finally, this unique illness mostly affects children as it can also lower their self-esteem and their self-confidence when they are seen as weird or unusual by their peers, therefore making them find difficulties when it is time to understand or make new friends.